Most part, and at least to the people that I talk to, people are afraid to trust themselves with their own healing process.
Right.
They're afraid, and they are going to rely on the answers from
That's fine.
the medicine gods that they've
I have
learned to
no
look up to
problem with
and
that.
respect.
Yeah.
And so another question is, over the years that you've been doing this, what kinds of enlightenment has the conventional medical community had to come to realize that complementary medicine or naturopathic medicine, the mind-body work that you do, is an important adjunct to the medical piece?
I can't speak for the medical profession in that sense, but I can say that the trend has been to be more receptive and the whole to what is being called complementary therapies. I don't like that term. It's not a compliment. I think the patient is in the middle, and whatever they may need for their healing is what they use. And one doesn't necessarily complement, but the phrase now again is integrate. We may need a doctor and a drug. We may need an herb and a remedy. We may need a counselor and a therapy. We may need a whole host of components to integrate for treatment to be part of the care.
So give us a definition
But
of mind-body. Tell us, what is mind-body medicine?
The main, just to continue to respond to that, and then I'll talk about mind-body medicine. But if you want to see what that trend has been, I practice in Fairfield County, Connecticut, Greenwich Hospital, Stanford Hospital, Norwalk Hospital. They all have integrative medicine departments. When I began in 1984, no way in the world would they have integrative medicine department where they have a nutritionist on staff, or a chiropractor on staff, or a naturopath on staff, or a stress management program on staff. So that has evolved. The practice in the individual doctor is still pretty conventional and still pretty conservative because they have a lot to learn and they have a lot to do being specialists. And so how I like to speak about that with my patients, I don't tell people don't go to the doctor. In fact, the opposite. Go to all the doctors you want and do whatever is appropriate in that. And if you're cured and healed, you don't need to see me. But if you've done all of that and you're still not well, then you need another approach or another way of looking at it. Now, my own view from a financial end and from a healthcare cost end, I think my kind of medicine, natural, preventive, holistic, complementary, alternative, whatever phrase you want to use, integrative, which is coming into the fore, that treats the whole person, that treats the cause, that uses the body's ability to heal itself, is much more cost efficient and much more preventive in the long run and ought to be the first resort of care. We know, unfortunately, the problem with health insurance and people not having health insurance, they don't go to any doctor because it costs too much, whether a naturopathic physician or a conventional allopathic physician. And so if we can engage people to understand and take responsibility for the health and participate. Now, the aspect of mind-body is what I shared with you, that if 80% of visits to the doctor are for stress-related complaints, that has to be addressed in some way.
Okay, so explain mind-body and this particular term that I've read in a lot of the literature. For example, I see that this is a magazine called Spirituality and Health.
Yes.
And in this magazine you were featured. There was an article about healing and curing, the journey of naturopath Paul Epstein. And you talk about a phrase that I really think sums a lot of it up. The body bears the burden.
Yes.
Describe that and how that works with your mind-body work.
So to understand the effect of stress is where stress lives is in the body. So if I'm stressed and I'm tense and I'm frustrated and I'm afraid or any of those more difficult emotions and I don't process them and I don't release them and I don't get them out of my system in a healing way, they live with me. I stay angry. I stay afraid. I stay frustrated. My body bears the burden means that it has its effect on us. Now, I talk about that when I talk about the most obvious of stresses, post-traumatic stress. Now, that's for a chronic stressor, a very intense experience, soldier in the war, sexual abuse as a child, domestic violence as a child, growing up in an alcoholic home, growing up with someone with mental illness. They've actually done a study called the Adverse Childhood Effects Study, that one of the greatest predictor of chronic disease later in life is from childhood trauma. That many children who grow up in homes where there might have been a trauma or a stressor that isn't processed, it lives in them and facilitates lifestyle changes, habits, and addictions and compulsions that can lead to illness, be it cigarettes or drugs or whatever the case may be. Okay? So these stresses and traumas, in a big way, have an effect on our body. There's also something called the Holmes scale, which actually gives points to a stressor in a person's life that you can almost measure that if they've gone through these stressors, they're more likely to exhibit a disease because their genetic predisposition for a disease will manifest sooner because of those stresses, like the straw that breaks the camel's back. So, for example, what's considered the #1 stress is the death of a spouse. Made even worse if prior to that death you spent 5 years as the main caregiver of an elderly spouse with Parkinson's, with heart disease, with Alzheimer's. The stress of that takes its toll on the body. And your predisposition to arthritis or heart disease or cancer will manifest itself prematurely. You will then go to the doctor and be treated for the diagnosis that needs to be addressed and treated to keep you alive and to deal with the pain, etc. But the underlying contributing factors that may have led to that are not always fully addressed.
Okay, so let's give an example. I'm suffering from migraine headaches.
Okay.
They are disabling. I'm set back in bed for 3 days every week or whatever. I'm going to go next week. I have an appointment with my neurologist, right. And then the following week I have an appointment with you. What's the neurologist going to do, basically, and then what are you going to do?
Okay. Well, the neurologist, I don't want to speak for the neurologist, I'm not a neurologist, but he's going to evaluate you. He's going to look for some of the causes that he might do some brain scans, he might do some EEGs, he might explore some other factors as to what might be causing the migraines and try to address that on a clinical, physiological, anatomical, pathological level. But oftentimes, so you picked a good symptom, oftentimes people have symptoms of pain, of chronic pain, for which there is no obvious pathophysiology, i.e. they have migraine headaches, but they don't know why. Similar to what chronic fatigue was, and similar to what fibromyalgia is.
And the neurologist is not going to figure out why either.
Then I don't know figure out why, but he will give medication, most likely. He will give a painkiller, which may mitigate against the symptoms, may have some side effects, may be effective, may not. Actually, I was just teaching, I do a lot of teaching around the world. I was just teaching in the Bahamas, and one of my students there, actually I was teaching on how to deal with chronic pain, was a neurologist from, I think he was from Norway. And we were talking about that, and he was looking for other options. So he wanted to study mind-body medicine as another approach. And he was saying, you know, I think this is, I'm quoting him accurately. He said, well, you know, if the medicine doesn't work the first time, what we as neurologists do is we try another medication.
Right, keep trying.
And the chance of the second medication working when the first one didn't becomes 50% less than the chance of the first medication working.
Now we're going to you. What are you
So
going
now what I do is, what I shared with you philosophically, is I'm going to take a history to try to find out who the person is and how the migraines have manifested in their life. When did they start? what might have contributed to them, what doctors have they gone to, what have they tried, what tests, because I also want to make sure that they've been seen by a neurologist to rule out a brain tumor, to rule out some other obvious pathophysiology that could be causing the migraines, for which the neurologist is the appropriate doctor or specialist to treat. But if the neurologist isn't finding that, and the only other option is a painkiller, fine, that's a crutch. Crutches are good, but we use the crutch while at the same time we're looking for the deeper healing.
Okay, so the deeper healing means you
Let
can
me just tell you what it may mean for different people.
Is that
No,
one of the tools
no,
you
I don't know.
use?
Every case is different.
Okay.
This is the answer for migraines.
Okay.
For some people, if we look at the whole person, now we just, to go into depth, okay, to go into greater depth to understand this, there's no simple answer. First, in terms of who the person is and what the cause may be, we might look at their diet and food allergies and that effect. We would look at stress and their lifestyle and their childhood and that effect. We'd look at their nutritional status and what do they take. We'd look at what's going on in their life now, and their muscular and their tension and their attitudes and beliefs. We'd look at the whole person. We'd look at other things going on in their mind and body in terms of symptoms. The neurologist may just treat the migraine, but I might be interested in their digestion, in their heart, in their back, in whatever's happening, so I'm taking a whole picture. From here, I will determine, this is before I even get to mind-body medicine, I will determine, do they need nutritional support, herbal support, homeopathic support? Do I think Chinese medicine will be the best approach? At some point, if I deem the migraines are contributed to or caused by some underlying deeper stresses for which the body is bearing the burden and that tension is living in them, because it's a learned pattern, if that's the case, then I will engage them in healing, in exploring. This is now we get into more counseling and mind-body counseling. I might teach them some meditation. I might do some guided imagery with them. I might teach them some relaxation. But ultimately, I would try to empower them to have a sense of understanding about their own body and their own mind-body connection, and how that childhood trauma might be contributing. That divorce from 20 years ago where they're full of anger and resentment might be contributing, etc.
Okay. All right, well, you've really given us a good idea of the kinds of work that you do, and I'm noticing from an article that you've written, we're going to talk about this in our next session because we're going to have you on next week as well.
Okay.
Can you come back?
Sure, I'm happy to.
Good.
Yeah.
We want to talk about the book that you've written also,
Okay.
that's been published. But I notice here that some of the different treatments that you use, let's say for that person who comes in with a migraine, could be, as you said, mindfulness meditation. We'll look at that next
Okay.
week. Guided imagery. We'll
Okay.
take a look at what that is. Stress counseling. Contemplative psychotherapy. That's why I asked. It's kind of, you need some
Counseling.
knowledge of counseling and
Yep.
therapy. Journaling. Narrative medicine, and so on. Those are some of the mind-body therapies that would work with somebody with chronic pain like a migraine. Okay.
Yes.
So we're going to end this session, and we're going to get ready to talk about your book next session.
Thank you.
So why don't you just finish up with a statement about the mind-body medicine. Got a minute.
Okay. Well,
1 minute.
in the essence that stress is a contributing factor to dis-ease, which we know to be true, the good news is that dealing with that stress effectively promotes health and healing. So there was a book by Kenneth Pelletier, who's considered the father of holistic medicine. And you asked why I became a naturopath. Then the title of the book is Mind as Healer, Mind as Slayer. And so from my perspective, mind-body medicine is using the person's mind, their attitude, their beliefs, their emotions as a healer.
Great. Thank you, Doctor. We'll be back next week. We'll see you next week on takeback.org. As usual, we hope we've given you something to think about. Good night.
Thank you very much. It was a pleasure.
Okay.